Established in 2006, Haven Behavioral Healthcare is building a sterling reputation of providing quality behavioral health care for its patients, their families, and communities. Powered by its pioneering hospital within a hospital concept, HBH offers a comprehensive treatment regimen for those elderly in need of behavioral services so they can have a smooth transition back to their communities.
The mission of Haven Behavioral is to provide superior behavioral health care to the families and patients that our hospitals interact with. We really accomplish this by attention to three outstanding principles that guide us: integrity, respect, and excellence. And when we describe excellence in our world, it really comes down to, is it a place that you would feel comfortable to send a relative or someone you loved for treatment? It really is an everyday, every staff member exercise. We try to challenge each other in terms of how we interact with patients. We try to constantly remind ourselves that this is a person, there's a family, there's a lot of anxiety associated with what's going on with the behavioral issues in this person, and to really make sure that we call each other on treating people as individuals and as people rather than as a certain diagnosis or a certain patient number.
With our population living longer than ever before, more and more elderly people are being treated for behavioral issues across the country, and many experts feel our current healthcare model is in dire need of a fresh approach to treatment.
The most common, and about 70% of the folks we treat have a dementia, but the dementia has to be associated with a psychiatric diagnosis as well. So associated with that, the most common is probably a psychosis or a paranoid psychosis. Psychosis just means loss of touch with reality. These folks become paranoid. Some hallucinate. Probably the next would be depressions, some anxiety disorders as well. So those are probably the largest areas that we would hit. Well, it is important that we make them feel comfortable in a home-like environment and not try to be real institutional or dogmatic with them and use the art of redirect.
Specifically designed to treat the unique issues of the elderly, Haven Behavioral Healthcare utilizes an innovative hospital within a hospital concept throughout its locations in Phoenix and Greater Colorado, which serves Denver, Pueblo, Colorado Springs, and the Western Slope areas. With strong clinical programs and proven results, Haven Behavioral Healthcare accomplishes its mission of bringing quality care to the geriatric population within the communities they serve in a safe, compassionate environment.
We try to treat our patients the way you'd like your family member treated, and the way we do this is by a multidisciplinary treatment team. In fact, I meet every day for the patients that I'm treating with the social worker, the activity therapist, and the nurse to go over what's happened in the last 24 hours, and then we meet with the patient. We also have a staff of hospitalists and primary care physicians, internists, that completely evaluate the patient from the start as well. So we're looking at both parts, the physiological as well as the psychological. The uniqueness of the hospital and within a hospital, especially for the geriatric patients, is most of them have quite a laundry list of physiological illnesses, and they can become acute very rapidly. And as opposed to a freestanding psychiatric hospital, we have rapid response immediately on call. We have emergency room that we can send them to, and we have the full support services of an active medical center. The ultimate goal is trying to improve their quality of life. Obviously, if they're paranoid and striking out, that's not a good quality of life, but also to return them to their point of origin, which for the most part are the nursing homes and the assisted livings.
Working closely with nursing homes, assisted living facilities, and home health agencies, Haven Behavioral Healthcare's groundbreaking approach allows host hospitals an opportunity to provide a much-needed service to the geriatrics in their area.
When a patient comes from a nursing home, we view ourselves as part of their continuum of care. We want to make sure that what we are doing is discussed thoroughly with the staff at the nursing home, And our goal, as well as theirs, is to make sure that the patient is able to reach their full capacity of independence. On the day of discharge, we communicate with the facility the interventions that have worked with the patient, and we offer to come in if need be to assist their staff in educating them and doing little in-services on the interventions that have worked with their patient.
One of the reasons we initiated this way of providing care is that the elderly frequently come with an inordinate amount of medical issues that sometimes have been undiagnosed or untreated. You couple the behavioral needs with the medical needs, and we think it is a unique environment where they're best treated, and that on our hospital, within the hospital, you have the specialty services that are necessary to provide care for the behavioral health issues, but yet right through the door, you have the med-surg hospitals, so you have immediate world-class medical backup for those patients. And some of the feedback we've received is amazement at the lack of an institutional feel to our hospital. Healthcare facilities are famous for an institutional feel, and we work hard at making it more like a home environment. The surprise at the individual level of care that is provided, the level of progress we've been able to make after we've done some work with some elderly patients so where they can interact more appropriately with family members and really process and conduct their life in a more independent manner. Haven is founded on the principle of being a specialty behavioral health care. We have a variety of different lines, geriatric being one. We certainly look at expanding the geriatric services we offer. We're always looking for communities and host hospitals that would be good partners for us to work with. We think there's quite a need for expanding the services as you look at the demographics, the specific needs of the elderly, and the expertise that we've developed in it. We look at this from a personal perspective. While it's not inappropriate, would you want your frail grandmother who maybe is in and out of contact with what's going on housed in a bed next door to perhaps a 40-year-old violent individual that the police brought in last night? We just don't think it's the best way to meet the needs of these patients. We think the hospital is an idea whose time has come that will be expanded in other markets to meet the needs of the community.
Learn more about Haven Behavioral Healthcare today, providing superior behavioral healthcare services to the people, communities, and hospitals they serve. For more information, go to havenbehavioral.com.